In the QUAZAR-01 studies, patients with AML were treated with maintenance treatment following complete remission after intensive chemotherapy. And there was a group which were classified as AML-MRC according to WHO 2008 and 2016 classification. So that means that these patients, these were about 100 patients, had an MDS karyotype or a previous history of MDS. And there was about 10% of the patients who had an NPM1 mutation. In this patient, similar to the whole patient group, there was a significant advantage for, especially for relapse-free survival, for those who received the maintenance treatment with oral AZA as opposed to placebo. And this is a very interesting piece of data because this is a patient group whose prognosis is inferior to that of other AML subtypes. They're usually elderly patients and they have unfavorable karyotype, and now according to the new classifications also unfavorable mutations. And so having a tool such as oral azacitidine as maintenance is very important since many of these patients are not eligible for allogeneic stem cell transplantation. So I think that the results of this trial, of this sub-analysis of the trial, are interesting and important, and it will be another tool we have for these patients to prolong survival and also to maintain MRD negativity or achieve MRD negativity.